Ever wondered what happens when something essential in your horse's body goes, well, a bit wrong? Maybe mysterious muscle tremors or that frustrating tying up? What if it's down to a tiny mineral imbalance? Today, we're doing a deep dive into equine hyperphosphatemia. That's basically an abnormally high level of inorganic phosphate in the blood. And our mission here is to sift through the veterinary research, the clinical notes you've shared, and really pull out the crucial stuff, the causes, the implications, basically give you a shortcut to understanding this specific, sometimes tricky condition.
Okay, let's unpack this. Starting at the basics. What exactly is phosphate? Why is it so important for horses?
Right. Phosphate is, well, it's fundamental, absolutely essential for so many things. Think bones and teeth, obviously. But also energy metabolism, ATP, the body's fuel. It's key for that. Plus, it forms the structure of cell membranes, helps with acid-base balance. It's everywhere.
Okay, so it's vital. But like lots of things in biology, there's a sweet spot, right? A normal range. Exactly. Too much or too little can cause problems. For adult horses, the normal serum level is typically somewhere between 2.5 and 5.0 milligrams per deciliter. But, and this is important, foals and growing youngsters, they naturally have higher levels.
Nah, because they're building bone.
Precisely. They're mineralizing bone rapidly, so their levels can be up to about 8.0 milligdl, and that's perfectly normal for them.
Got it. So higher in foals is expected. But in an adult horse, when those levels climb too high, what starts to happen? What's the danger?
That's where things get complicated and potentially serious. See, phosphate and calcium are tightly linked. Their balance is controlled by hormones, things like parathyroid hormone or PTH, vitamin D, and another one called FGF23. The kidneys play a huge role too.
Okay.
So when phosphate goes up, it disrupts this whole system. The biggest, most immediate danger is often hypocalcemia, low calcium.
Low calcium. But the problem is high phosphate.
Yeah, it seems counterintuitive, doesn't it? But what happens is excess phosphate in the blood grabs onto calcium. They form these calcium phosphate complexes. This pulls the free ionized calcium, that's the biologically active form the body actually uses, out of circulation.
Ah, I see. So the total calcium might seem okay, but the usable calcium drops.
Exactly. And that's often what causes the clinical signs. We see signs that actually look like low calcium problems.
Okay, that makes sense. Are there other dangers besides the low calcium?
Yes. If the hyperphosphatemia is severe and goes on for a while, especially if calcium is also high, or just if the combined levels exceed what can stay dissolved, you can get something called metastatic mineralization. Basically, calcium phosphate salts start depositing in soft tissues where they shouldn't be.
Ooh, whereabouts?
Think vital organs. Kidneys, lungs, heart muscle, blood vessel walls.
Oh, wow.
Yeah, and that can lead to serious organ damage, dysfunction, even failure over time.
That sounds incredibly serious. So unraveling the why behind this must be key. What actually causes phosphate levels to spike like this in horses? I gather it's not always straightforward.
Not always, no. And this is where horse physiology is, well, a bit unique compared to, say, dogs or cats. You might immediately think kidney failure, right? That's a common cause of high phosphate in other species.
Yeah, that makes sense. Kidneys filter waste.
Right. But in horses, advanced chronic kidney disease usually causes the opposite problem.
The opposite.
Yeah. Horses typically end up with high calcium, hypercalcemia, and low phosphate, hypophosphatemia. It's because the horse kidney is a major way the body gets rid of excess calcium. When the kidneys fail chronically, calcium builds up, but phosphate excretion often remains relatively okay until the very end stages.
Ah. So high phosphate due to kidney failure is actually rare in horses.
Primary chronic kidney failure causing high phosphate, yes, it's rare. If you do see high phosphate linked to the kidneys, it usually signals very severe, very acute kidney injury, a sudden, massive insult to the kidneys.
Okay, that's a really important distinction. What else then, if not usually chronic kidney failure?
A big one is massive tissue injury. Cell destruction, basically. Remember, phosphate is mostly inside cells.
Right, you said it's part of cell membranes and energy.
Exactly. So if lots of cells break down suddenly, all that intracellular phosphate floods into the bloodstream.
Like in...
The classic example in horses is severe rhabdomyolysis, tying up.
Ah, okay.
That massive muscle breakdown releases phosphate along with potassium, muscle enzymes like CK and AST, and myoglobin, which makes the urine dark. Less common things in this category might be acute tumor lysis syndrome, where cancer cells break down rapidly, or severe hemolysis, which is red blood cell destruction.
Okay, massive cell damage. What about taking too much in? Can that happen?
It can. Sometimes it's iatrogenic, meaning caused by medical treatment.
How so?
The most well-known example, especially in foals, is using phosphate-containing enemas. Things like fleet enemas, sometimes used for meconium impaction.
Oh, right.
If too much is given, or given repeatedly, the foal can absorb a dangerous amount of phosphate very quickly. This can cause acute, severe hyperphosphatemia and that dangerous drop in calcium we talked about.
Wow, okay. Good to know. What about diet? Too much phosphorus in the feed.
That's another area where it's a bit nuanced. A diet with way too much phosphorus compared to calcium, like a KP ratio below 1.1, when it should be more like 1.5.1 or 2.1,
Right.
that can definitely cause problems, interfering with calcium absorption and leading to secondary nutritional hyperparathyroidism.
Beakhead disease.
That's the one, or osteodystrophia fibrosa. You see changes in the facial bones. But interestingly, the blood phosphate level in those cases is usually normal or even low.
Huh. So the dietary imbalance causes bone problems, but not necessarily high blood phosphate.
Generally, no. Getting true hyperphosphatemia just from diet alone is pretty rare unless the intake is astronomical and the horse's ability to excrete it is somehow impaired.
Okay. Any other causes? This is quite a list.
A rarer but serious one is vitamin D toxicity. Hypervitaminosis D usually happens from accidentally eating toxic plants containing vitamin D analogs, things like day-blooming jessamine or golden oat grass, or sometimes massive oversupplementation.
And vitamin D boosts phosphate absorption.
It boosts both calcium and phosphate absorption from the gut, so you end up with high calcium and high phosphate.
Double trouble, leading to that mineralization issue.
Exactly. That combination really predisposes them to metastatic mineralization. Then there are a couple of other, less common things. Transcellular shifts phosphate moving out of cells into the blood, which can happen with severe metabolic acidosis. And very rarely, conditions where parathyroid hormone isn't working properly, like hypoparathyroidism. PTH normally helps the kidneys dump phosphate, so if it's missing or ignored, phosphate can build up.
Okay. One last thing, though. You mentioned something about artifacts, false readings.
Yes, crucial point. Pseudohyperphosphatemia. It's a lab artifact. If the blood sample hemolyzes, meaning the red blood cells rupture during collection or handling.
They release their internal phosphate.
Exactly. Red cells contain a lot of phosphate, so if they burst in the tube, it artificially raises the phosphate level measured in the serum or plasma.
How would you know?
The lab usually flags it, and the serum or plasma might look reddish or pink instead of clear yellow. It's really important to consider, as it could lead you down the wrong diagnostic path entirely. Always check the sample quality.
That is super important practical advice. Okay, so we have this whole range of potential causes, from kidney injury to diet mistakes to lab errors. Let's shift the horse itself. What clinical signs might an owner or vet actually see?
Good question. The signs are often, well, a bit vague or nonspecific. They're usually related either to the underlying cause or, more critically, to that secondary hypocalcemia.
Right, the low calcium effect.
Yeah. So you might see things related to neuromuscular excitability because calcium is low, muscle twitching, fasciculations, or tremors, maybe generalized muscle weakness, stiffness, even incoordination, which we call ataxia. In more severe cases, you could see cardiac arrhythmias because calcium is vital for a heart rhythm. And very rarely, full-blown tetany or seizures.
So those are mostly low calcium signs. What about signs of the original problem?
Absolutely. You'll often see signs pointing to the root cause. If it's rhabdomyolysis, you'll see muscle pain, stiffness, reluctance to move, that dark urine.
Right.
If it's, say, vitamin D toxicity, maybe weight loss, lameness, a stiff gait. If it's that chronic dietary imbalance causing big head, you might notice the enlarged facial bones. And if that metastatic mineralization has started setting in chronically,
That you see organ problems.
yeah, potentially signs of kidney failure or respiratory distress if the lungs are affected, maybe just a stiff, painful gait if deposits are forming elsewhere.
Okay, so the signs can be quite varied. If a vet suspects hyperphosphatemia based on some of these signs, or maybe finds it on routine blood work, what's the diagnostic game plan?
Well, the first step is confirming that elevated inorganic phosphate pi level on a serum biochemistry panel. And crucially,
Making sure the sample wasn't hemolyzed?
exactly, check for homolysis. Then you absolutely must measure serum calcium at the same time, both total calcium and ideally ionized calcium, since that's the active form that's likely low.
Okay, phosphate and calcium together. What else?
You'd run other blood tests based on suspicion, CK and AST if you suspect muscle damage, BUN and creatinine to check kidney function, electrolytes, And a really detailed history is vital. What's the diet? Supplements? Any medications, especially enemas and foals, recent illnesses, any possible exposure to toxic plants.
The detective work.
Pretty much. Plus a thorough physical exam to look for clues, muscle soreness, bone changes, heart rhythm issues, neurological signs. And in some chronic cases, imaging like x-rays or ultrasound might be helpful to look for that soft tissue mineralization.
Right. So once you have the diagnosis and hopefully the underlying cause,
Yeah,
how do you treat it? I assume fixing the cause is priority one.
absolutely. Treatment focuses on addressing the underlying cause first and foremost and managing that secondary hypocalcemia if it's present and causing signs.
So how do you tackle the cause?
It depends. If it's dietary, you correct the diet, remove excess phosphate or vitamin D sources. If it's an accidental enema overdose, you stop giving them. If it's rhabdomyolysis, aggressive IV fluids are key to flush the kidneys and support hydration, often along with pain relief like NSAIDs, maybe muscle relaxants.
And for kidney injury?
Again, IV fluids are critical for acute kidney injury, trying to support kidney function and encourage urine production. If there's severe metabolic acidosis contributing, that needs correction too.
What about the low calcium?
If the horse is showing clinical signs of hypocalcemia, those twitches, tremors, weakness, then careful intravenous calcium gluconate is given, slowly while monitoring the heart rate.
And then maybe ongoing calcium.
Yeah, once the immediate crisis is passed, oral calcium supplementation might be needed for a while.
Okay. And can you do anything to directly help the horse get rid of the excess phosphate?
Yes. Promoting urine output with IV fluids diuresis helps, as long as the kidneys are working reasonably well. And crucially, we can use oral phosphate binders.
Binders, what are those?
They're substances like aluminum hydroxide or calcium carbonate given with feed. They basically bind to phosphate in the gut, preventing it from being absorbed into the bloodstream.
Ah, like a sponge.
Sort of, yeah.
Yeah.
So the phosphate gets trapped and passed out in the manure instead. And throughout all this, of course, close monitoring of blood phosphate, calcium, kidney values, electrolytes is essential. And adjusting the diet long-term to ensure that balanced KFP ratio.
It sounds like a really intensive, multi-pronged approach is often needed. So, wrapping this up, what's the outlook? What's the prognosis for a horse with hyperphosphatemia?
It's highly variable. Really depends entirely on why the phosphate is high, how severe it is, and how quickly it's addressed.
When is it generally good?
The prognosis is often good to excellent for mild transient increases, like mild tying up that resolves quickly, or that iatrogenic enema exposure if it's caught and treated promptly. And obviously, it's excellent for those foals with normally higher levels due to growth. That's not a disease state.
Okay. And when is it more worrying?
It becomes guarded to poor if the hyperphosphatemia is severe and persistent, especially if it's caused by massive, uncontrolled tissue damage, like really bad rhabdomyolysis, or severe acute kidney injury that just doesn't respond to treatment. And vitamin D toxicity can carry a poor prognosis because that metastatic mineralization can be widespread and irreversible.
So damage to vital organs might already be done.
Exactly. Or if there's some other severe, untreatable underlying disease causing it.
That really underscores the main message then. Because the potential complications like severe hypocalcemia and that soft tissue mineralization are so serious, any significant jump in phosphate in an adult horse really needs a thorough vet workup.
Absolutely. Don't ignore it.
So thinking about this delicate balance, between calcium and phosphate and just how interconnected everything is, it really makes you think. What new questions does this deep dive raise for you, our listener, about maintaining optimal health, whether it's in your animals or even yourself? Something to ponder.